Why is an endoscopy needed for GERD diagnosis? Imagine trying to see inside your body without opening it up. That's what an endoscopy does for doctors when they want to understand what's happening in your esophagus and stomach. If you have symptoms like frequent heartburn, chest pain, or difficulty swallowing, your doctor might suggest an endoscopy. But why exactly is this test so important for diagnosing gastroesophageal reflux disease? Endoscopy allows doctors to look directly at the lining of your esophagus and stomach using a thin, flexible tube called an endoscope. This tube has a tiny camera attached, which sends images to a monitor. Seeing inside helps doctors find signs of damage caused by stomach acid, like erosive esophagitis, which is inflammation or sores in the esophagus. It also helps identify strictures, which are narrowings of the esophagus that can cause swallowing problems. Another reason for an endoscopy is to check for Barrett's esophagus, a condition where the lining of the esophagus changes because of long-term acid exposure. This change can sometimes lead to esophageal cancer, so catching it early is very important. During the procedure, doctors can also take small tissue samples called biopsies. These samples help test for infections, abnormal cells, or early signs of cancer. Doctors usually recommend an endoscopy if your symptoms are unusual or severe. For example, if you have trouble swallowing, unexplained weight loss, or if your symptoms do not get better after taking medications that reduce stomach acid. These medications are called proton pump inhibitors, and they help decrease acid production. If they don't work, an endoscopy can help find out why. It's also useful if you have alarm symptoms like coughing, hoarseness, or vomiting blood. These signs could mean there's something more serious going on. Endoscopy can rule out other causes of your symptoms, like infections or tumors, giving your doctor a clear picture. While the procedure is generally safe, it does carry small risks, such as reactions to sedation, minor bleeding, or a rare chance of tearing the esophagus. Still, these risks are very low, and the benefits of getting a clear diagnosis often outweigh them. In the end, an endoscopy is a key step in understanding how your GERD has progressed, checking for complications, and helping your doctor decide the best treatment plan. It's a direct, effective way to see what's happening inside your body, especially when symptoms are stubborn or unusual. That's why it's such an important tool in managing acid reflux and gastroesophageal reflux disease.